Hello, I'm Dr. Hemi Yu, plastic surgeon in Gangnam, Seoul, Korea. Most people think all the collagen stimulators work the same way, but the type of collagen they create and the tissue they affect make a huge difference in how the face ages. Sculptra or PLLA mainly stimulates type 1 collagen, which is the same collagen we find in bone, tendon, and strong structural tissues. That's why Sculptra tends to give deep volume restoring over time, but it usually requires multiple sections because the goal is to slowly rebuild volume that has been lost. Radiesse or calcium hydroxyapatite work differently. It first creates a softer network of the type 3 collagen, which is what we naturally see in younger tissues, like blood vessels and mucosal areas. Type 3 collagen is more flexible, more baby-like, and it matures later into type 1 collagen as the tissue stabilizes. So the difference is simple. Sculptra, volume first, slower, deeper, type 1 dominant. Radiesse, structure, and elasticity, faster response. Type 3, type 1 transition. Radiesse also forms a firmer scaffold, so you get immediate support while the collagen forms around it later. And because of the way it integrates, many patients notice that expressions stay natural instead of looking frozen or overfilled. Another practical difference: Sculptra has a known risk of nodules if the product isn't diluted, massaged, or placed correctly. Radiesse can still form nodules if incorrectly used, but overall, its nodule rate is considered lower, especially with proper dilution technique. So, when people ask me, which one is better? I always say, neither is better. They simply do different jobs. Sculptra is for long-term volume restorations. Radiesse is for shape, support, and skin quality. The smartest choice is not the brand name. Subscribe and get real K-beauty tips from Korean doctor. Bye!